Now, with our focus still on muscles, we'll move on to look at the four muscles which form the great expanse of the lateral and anterior abdominal wall. These muscles fill in the huge gap that's created by the costal margin above, the edge of the thoracolumbar fascia behind, and the iliac crest, the inguinal ligament, and the pubic crest below. First, we'll look at the rectus abdominis, which runs vertically next to the midline from the lower anterior ribs to the pubis. Then we'll look at the three large flat muscles, transversus abdominis, internal oblique, and external oblique. There's a time-honored word that's used in describing the tendons of the flat muscles, aponeurosis. Aponeurosis is a word that's used to describe a tendon that's in the form of a sheet. We'll look at the rectus abdominis muscle first. Here's the rectus abdominis, together with the innermost of the flat muscles, transversus. The rectus abdominis is a very long muscle, wide at the top and tapering to a more narrow attachment at the bottom. It arises from the 5th, 6th, and 7th costal cartilages. It's inserted on the pubic crest. The rectus is divided on the front by these bands of tendon called tendinous intersections. Sometimes there are 3 of them, sometimes 4, as in this case. The intersections go about halfway through the muscle. The action of the rectus muscles is to produce flexion of the lumbar spine. The rectus muscles act in opposition to the erector spinae muscles. Besides producing active flexion, the rectus muscles have an important static effect. They keep the lumbar spine straight at times when the force of gravity tends to extend it. In the intact body, the rectus abdominis is enclosed on the front and on the back by a tendinous envelope that's formed by the aponeuroses of the 3 flat muscles. This is the posterior layer of the rectus sheath. The posterior layer ends here, about 3/4 of the way down the muscle. Sometimes it ends gradually, sometimes abruptly, with a distinct lower border, known as the arcuate line. Below here, there's just a little loose fascia between the back of the rectus and the peritoneum. Now we'll add the anterior layer of the rectus sheath to the picture. The anterior layer extends all the way from the costal margin to the pubis. If we incise the anterior rectus sheath and try to retract it, we can see that it's firmly attached to the tendinous intersections. There's one here, another one here. Here, we've divided those adhesions so that we can retract the anterior rectus sheath medially. The 2 layers of the rectus sheath come together near the midline. Here's the posterior layer. Both layers insert into this dense midline band of tendinous tissue the linea alba. The linea alba extends from the xiphoid process to the pubis. We'll see more of the rectus sheath as we look at the aponeuroses of the 3 flat muscles. We'll look at the flat muscles next. Flat may not be the best word to describe them. In the vertical plane, they're markedly curved, as we'll see. We'll look at all 3 of them, then we'll look at their actions. We'll start with the innermost of the 3 flat muscles, transversus abdominis. Here's transversus abdominis. The fibers of transversus all run in the same transverse direction, except the lowest ones, which run obliquely downwards. Transversus abdominis has a long line of origin, from here to here. At the top, its fibers arise from the inner aspect of the costal margin, from the 6th rib to the 12th. Between the 12th rib and the ilium, transversus arises from the edge of the thoracolumbar fascia. Below, it arises from the inner aspect of the iliac crest. The lowest fibers of transversus arise from the most lateral part of the inguinal ligament. transversus has a short, free lower border. The muscle fibers of transversus end in this broad sheet of tendon, the transversus aponeurosis. The transversus aponeurosis fuses here with the aponeurosis of the overlying internal oblique muscle to form one aponeurotic layer. Now we'll add the internal oblique muscle to the picture. The internal oblique arises from the thoracolumbar fascia and from the iliac crest. The lowest fibers of the internal oblique arise, like those of transversus, from the lateral part of the inguinal ligament. Like transversus, the internal oblique has a short, free lower border. The internal oblique fans out so that its highest and lowest fibers run in markedly different directions. Back here, the fibers of the internal oblique run steeply upward. Here, they run less steeply. Here, they're transverse. And here, towards the inguinal ligament, they run downward. The highest fibers of the internal oblique insert on the lowest three ribs. Its remaining fibers end in this internal oblique aponeurosis, which, as we noted, fuses on the underside with the transversus aponeurosis. It's also joined on its outer aspect by the external oblique aponeurosis. This is the cut edge of external oblique. From here to here, the combined aponeurotic layer divides at the edge of the rectus into two layers, one passing behind and one in front of the rectus. Below here, the combined layer doesn't divide, but passes entirely in front of the muscle. Now that we've looked at the internal oblique, it's time to add the external oblique muscle to the picture. Here's the external oblique muscle, the outermost of the three flat muscles. The fibers of the external oblique spiral downwards and forwards at the side, downwards and medially in front. The external oblique arises from a broad area on the outside of the rib cage, all the way from here on the 12th rib to here on the 5th rib. The zigzag line of origin of the external oblique fits in with the line of origin of serratus anterior. Though it's all one continuous muscle, we'll look at the external oblique in two parts. A posterior part that arises from the 12th to the 10th ribs, and an anterior part that arises from the 9th to the 6th rib. The anterior part of the external oblique ends in this external oblique aponeurosis. This fuses with the combined aponeuroses of the other two flat muscles to form the anterior rectus sheath. The external oblique aponeurosis has a long, free lower border between the anterior superior iliac spine and the pubic tubercle. As we've seen already, this free lower border is the inguinal ligament, which we'll see in detail shortly. The part of the external oblique that arises from the 10th to the 12th ribs remains fleshy from its origin to its insertion. It inserts along the outer edge of the anterior half of the iliac crest. Here, at the back, the external oblique has a short free border between the 12th rib and the iliac crest.